Southwest Austin. Thanks for everybody for joining us. We have a very exciting meeting planned for you, and that involves lots of different voices. So mine is going to be the least of them. I'm just here to help guide us through. So we're going to kick off with Jenny Sue, who's visiting us. She's going to announce her candidacy and tell us a little bit about who she is and what she's running for.
Yes, hi. Thanks so much for giving me time to speak today, Michelle. I actually am now an official member of Southwest Blue Action Dems, so I'm very proud to say that. But I actually helped a lot in the last cycle as well with writing postcards. So for those that haven't seen me at these meetings, I have been involved. I've been around, just not necessarily in person on these meetings. I am running for Texas State Senate in SD 25. I want to take Donna Campbell out of that seat. For those that are in SD 25, you know that she is not responsive at all about her constituents. She doesn't really care about what her constituents care about. And she is really awful on a lot of the issues that I feel strongly about. And those are public health. I am the founder and leader of Immunize Texas. And in that time, I have seen how the state can improve public health measures, and we're not doing it. And especially with the COVID response, we've seen where those gaps are. So there's a lot of room for improvement there. I'm also a mom to two small children. I have an 8 and a 4-year-old. I'm down here in the part of Austin that my kids go to, Mills Elementary. So I've been heavily involved with the PTA there, as well as Texas PTA. And public education is very important to me. I want to see it fully supported. I want to see it funded. I want to see our children, no matter who they are, insured with a quality public education. And I think that's really the key to solving a lot of the problems in SD 25. If you have a lot of support going to public education, then you have things like better public health measures, and you have better policies in general, and you can expect your leaders to make common sense decisions. And we're not seeing that right now. So I don't really want to take up too much time. I know you have a lot of stuff to cover in this meeting, so I will put my links in the chat. Of course, like all candidates, what I'm looking for right now is help in 3 ways. I'm looking for donations to help keep my campaign going. We've gotten a lot of good response from Comal County and Guadalupe County and Bernie and all those places. So we are making a difference, and we want to keep that going. Secondly, I'm looking for volunteers. We are slowly expanding the team, and I know it's very early. Our primary is not until 2022, but there is work to be done. And then finally, I'm asking for everyone on the call to share my name with as many people as you can. A lot of what's ahead of me is getting my name out there, getting recognition, and making a difference for my district. So thank you so much for your time, and I will put those links in the chat.
Thanks. Thanks. Jenny lives in precinct 366. So just a shout out. Another awesome precinct.
The best precinct.
Right. All right. Thank you. Do we have any other candidates or anybody else who has an announcement? Okay. Well, I'm going to hand it off to Lizette, who has a membership update for us.
Hey guys. Hello. All right. So yeah, we do have a membership update. If anybody was on the call last month, we were sharing the link to sign up to be a family member, individual sustaining member, or individual member. And we had a dinner for democracy as well in February with via 313 Pizza. And so far that's gathered us about a little over 60 members since January 1st, but in 2020 we had 228 members. So if you haven't signed up or renewed your membership for this year, please do so. And then of course, if you have any neighbors or friends who you know are also progressive and also just want to get stuff done, like our saying, send them our way or send them this link, and I will share the link in the chat if it's not there already for you guys to join us. Oh yeah, they already shared it. Great. Thanks everyone.
Thanks, Lizette. Okay, so Elisa's up next.
Hi everyone. I just want to talk to you guys about getting a vaccine. So if you guys happen to be 1A, 1B, and you're still having trouble getting an appointment, I will put my information in the chat, and I will assist you in getting an appointment. But if for some reason you're like me, last in line, you can still get a shot. There are plenty of volunteer opportunities out there. And lucky for us, Terry is with us, and she has created a spreadsheet of all the different volunteer opportunities that are nearby. So I'm going to let Terry speak about all those choices.
Right. So I've just been gathering information from all my friends and family who have also found volunteer spots. Elisa will drop the link for the spreadsheet that I've created. So I'm going to walk through what I found and kind of the process for all of these. So the first one I've got on my list is UT Health at Gregory Gym. Unfortunately, right now they are backlogged on how many volunteers they're still processing. So there's a pretty extensive registration process for them. You have to do this 2-hour FEMA training. You've got to sign up for UT MRC. There's a background check that you have to pay for yourself. So my husband and I signed up for that one at the beginning of the winter storm, and we haven't heard back. So just heads up that one, they will need people down the road. They're just not currently taking applications right now. The second one on the list here is Williamson County. So this one doesn't have as many hoops that you have to jump through. The only thing is that when they update that sign up on Saturdays at 5 p.m., they go really fast. So I think 2 Saturdays ago, I checked and all the spots were gone within 5 minutes. The third one on the list here, Hayes County. So this one, you do need to register with them ahead of time as a volunteer. And then they'll send you a code when it's time to sign up. So currently right now they have some first dose clinics that have some open spots, and then second dose clinics. If you're looking for a vaccine and you haven't gotten your first one yet, you want to sign up for a first dose clinic. Never guaranteed, but they do try to vaccinate people once they have leftovers at the end of the shift. All right, Bastrop County. This one's the one I've had the most luck with. You have to do a HIPAA training. Takes maybe like an hour, email that certification back to them. And they last time dropped a ton of shifts for all of March. And so I was able to get lots of friends and family set up there. They're very organized. I've already volunteered with them twice. I was able to get my vaccine with them the first time I volunteered. Tons of spots there. They're looking for non-medical help. So traffic, registration, all that good stuff. Now with CODA, you do need to pre-register ahead of time. That way you get the emails when the signups go up. So I've got the link there in the spreadsheet. So make sure that you're signed up there. They were really good about sending an email out before the sign up went up, and they had tons and tons. I've heard that they try to vaccinate volunteers if there's leftovers, but they also explicitly say, please don't expect one. So I think that's just to discourage people who are only looking for a vaccine. And then Bell County. So again, this is another one that goes really, really quickly. I think they use that same Sign Up Genius link. This was shared by somebody else, but I'm pretty sure that they use the same one and just update it week by week. So this is another one that you gotta just get on top of as soon as they post the link or post the new shifts. Everything else on my list, these are San Antonio and Brazos Valley. I don't have a ton of information about those. I know that for the Alamo Dome, they're now telling volunteers that you need to do at least 2 shifts, but I'm not sure how they're tracking that. So just heads up on that. And yeah, it's a great way to get in there to help out. Everybody's been so grateful. You feel really good when you're done volunteering. And I've had a lot of really good luck hearing from other people getting their shifts done and then being offered a vaccine at the end.
I will add, for most of the places, they really want to get the vaccines out. So if they have the shots and you're a volunteer, you will get one. So I volunteered in Bell County, and Monday they had tons of vaccines. Tuesday, tons of vaccines. Wednesdays, tons of vaccines. Thursday, they were running low, and the volunteers really weren't going to get a vaccine. So when you look at, they're like, oh, we don't give a vaccine. It really means if they're short on shots, you're not going to get one, but everyone there really wants you to have a shot. The other thing that I'd say is about second doses. Each county has a different procedure for getting a second dose, but that's another thing. I mean, when you get your shot, just ask, hey, what's the procedure? How do you get a second dose? I know that I got it through Bell, and they have a specific website to sign up. So go do it, go get vaccinated.
And help other people get vaccinated. It's super fun because people are super excited. Okay, so I have a quick update on bylaws. So we're redoing our bylaws slightly because we'd like to start moving our board handoff a little bit earlier. We feel like handing it off in December right before our primary is painful and inflicts unnecessary misery on, you know, the next president. So so anyway, good to update the bylaws occasionally. So what I'm going to do is I'm just giving you guys notice that we're doing a bylaws update. We're going to vote on these. I will drop the link in the chat. Is Rachel Jackson with us today?
I'm here. I'm here.
Do you want to give a
Hi.
quick update on the Ledge Committee?
Oh, sure. Well, as people can only imagine, things are going sort of fast and furious after the big freeze. Lots of legislative happenings when it comes to hearing from constituents about what happened in the storm, et cetera. So I expect that will probably continue for some time. The deadline to file bills is actually it's coming up this week. I can't remember if it's either the 12th or the 13th. So I'm also imagining there's going to be kind of a flurry of legislative activity this week as folks get their final bills signed. So stay tuned for more. That's about all I have right now.
Okay, thank you. The other thing we're doing with the Texas Ledge is we are doing those lit drops that we chatted about when you joined the meeting. And we're focusing on 10 precincts, tier 4 voters. Remember, those are our solid deed voters. These are folks not only that are in tier 4, but that they have also either voted in the primary, Democratic primary in 2020 or 2018. So we're targeting those houses with an action item. It's a bit of a marketing piece for us as well. Contacting them with their precinct chairs could be that we can roll and pick up a few more volunteers in addition to that. We've got more precincts to hit next weekend. It's beautiful weather. It's a nice walking time. If you just want to pick them up and do them, you know, one afternoon or evening in your neighborhood, we can totally work that out. So go ahead and sign up. I'll drop the Mobilize link again in the chat. If you want to do it in your precinct, reach out to your precinct chair. Remember, they're all listed on blueactiondems.com/SWATX. All right, that is it for Texas Ledge. Now I'm going to hand it over to Tina, who's going to introduce our speaker.
Yeah, thanks so much. So we are so lucky to have Ann Duckelberg come. She's a program director of Every Texan, which is formerly known as the Center for Public Policy Priorities. And Every Texan is the premier social justice organization dealing with policy in Texas. So she has obviously a lot on her plate. Ann is a founding member of the statewide Children's Healthcare Coalition and also Cover Texas Now. She joined Every Texan in 1994, so she has been at this for a while. And I know personally that she is the go-to expert on Medicaid and Medicaid expansion for both our state legislators and for journalists alike. So I have put her lengthy bio in the chat, and I'll redo that again. And Ann, the floor is yours.
Oh yeah, unmute. Hi, thank you guys very much. I've been getting a lot of invitations to talk about Medicaid expansion lately, and you know, to all kinds of groups with like no background and tons of background, and you guys are probably more on the tons of background end of it. So I'm going to kind of go quickly through the slides that I have right here. Oh, wonderful! Somebody's doing it for me. That's awesome. And obviously, you know, hopefully we'll have plenty of time for questions. So that's just a background slide. If you had never heard that we changed our name or just never heard of us at all, we were founded by Benedictine sisters. They set us free in 1999, but we retain our social justice roots. So what's the next slide? unless I'm advancing them. Okay, so just a reminder, we have the worst uninsured rate and the worst uninsured number among the states, not just by a little bit, but by a big margin. You can see this is a Census Bureau slide. Big old gap between us and the next worst state of Oklahoma. Next slide. This is a slide that my staff would tell me has way too much information on it, but I'm not going to read it all to you, just so you know you have it, since everybody will get a copy of these slides. So basically, the latest census data we have for the uninsured are from 2019. So that means they are all pre-pandemic. So things will presumably look even worse when we get 2020 numbers, and they're going to look worse in Texas and the other 11 states that haven't expanded Medicaid, because in the states that have, like our neighbors in New Mexico and Louisiana and Arkansas, and soon to be Oklahoma, the people who lost the only job they had and suddenly found themselves with no income, they were able to go to Medicaid in those states, and in Texas, they just became uninsured. So we are looking for things to look worse when we get the 2020 numbers. And then just the takeaway I would have is the uninsured rate depends hugely on what age group you're in. Our kids are almost twice as likely to be insured as our adults are, which is counterintuitive because kids don't have jobs, and jobs are the main way people get insurance. But our kids have Medicaid and CHIP, and our adults essentially don't. So let's look at the next slide to see how that plays out. This is just, I won't go into the weeds on this, but just so you have a sort of visual, this is from 2018, of what the status of all of our Texans are with regard to access to coverage. So you've got this big old frightening 5 million uninsured, a lot of different ways that our state could be trying to help them that unfortunately we aren't. These are state policy solutions that are listed here, not, there are a number of really important things that only Congress can do, and Congress is doing some of them in the Rescue Act, which we hope will be on the president's desk for signature in the next week. But bottom line is, when you look at our uninsured population, there's no one solution that is going to flip a switch and make all 5.2 million of them insured. Medicaid expansion, however, is the single biggest and the one that brings in a giant chunk of your federal tax dollars coming back to Texas. Let's see what the next slide has on it. I think that's a pie chart. So this is, I'm taking you back to June because you may remember one of the first coronavirus response laws passed back a year ago in March was the Families First Coronavirus Response Act. And that is the one that said, guess what, states, we know things are going to be terrible for you fiscally, and we are going to add 6.2 percentage points to your federal funds matching rate for Medicaid. And Medicaid in Texas is over $40 billion a year. So when they bump up the federal share of every single dollar, it is a very large amount of money. So throughout this entire public health emergency, this will be billions of dollars that Texas has gotten in extra federal money, which therefore frees up the state general revenue dollars that we have to put up to fulfill the state's portion of our Medicaid program. So one of the things that law did was, as a condition of giving this giant download of federal funding, you have to keep everybody on your Medicaid rolls until the public health emergency is over. So starting last year, March of 2018, the rolls have been frozen. And so I didn't try to get you a more recent month because it would have been a really distorted picture of Medicaid enrollment that will never be seen again, presumably. So everybody who was on March 18th is still on, and everybody who applied for and got Medicaid since March 18th is. So, but this looks more like what Texas Medicaid would have looked like in any given month over the last couple of years before the pandemic started. So big takeaways, if you didn't already know it, Medicaid in Texas is mostly children, that we have over 3 million kids on any given day just by just by income who qualify. Then you have another group over here of kids with very serious disabilities So that made up another 163,000. And then there's a separate, much smaller program, the Children's Health Insurance Program, that covered around 320,000 kids. And you can see here the various categories for adults, which are adults with disabilities. And again, those are serious disabilities that pretty much have to make it impossible for you to work. Seniors who are below the poverty line, so that they have Medicaid helping them out with what would otherwise be really insurmountable out-of-pocket costs for Medicare. And then we have this tiny group of poor parents. So you've got over 3 million children on any given day getting Medicaid, and fewer than 152,000 of their parents qualify. Well, and this is what leads us into Medicaid expansion. Then another huge role of Medicaid, a lot of you who may not have known it before probably learned during 2017 when the Republicans were trying to repeal the Affordable Care Act, that more than half the babies in the United States are delivered by Medicaid, and Texas is no exception. We're a little bit higher than that. They don't get the coverage until they have a positive pregnancy test. They lose the coverage 2 months after the baby's born. So we could be doing a lot better for women if we could help them get healthy before they conceive, and help them with all their medical conditions after they have babies too. So Medicaid expansion would be a big gift to maternal and infant health as well. Let's see what's next. A bar chart. You were hoping for a bar chart, right? So this is, you either love it or you hate it, but this is needed to sort of explain how on earth do we have 3 million children on Medicaid and only 151,000 parents? Well, this is the income cap for parents. This is the example we've shown here is a single parent with 2 children. If that mother or father earned $3,900 a year, they would make too much to keep their Medicaid as a parent. And there is no door for a person who isn't a parent with a dependent child to walk through unless they are fully disabled or are pregnant. So this, how on earth did this happen? The income cap for parents in Texas Medicaid was set by the legislature in 1985 as a fixed dollar amount without any updates for inflation. And so basically the percentage of the federal poverty income, which does get updated every single year by Congress, shrinks, keeps shrinking and shrinking. So as a result, let's see what the next slide looks like. So we will show you in a second what the other states look like, but the Kaiser Family Foundation is a fabulous source of information on all these things. And one of the things that they'll show you is these are the orange states are the states that still haven't expanded Medicaid. What a great set of role model states for Texas this is. And basically, and Missouri and Oklahoma have passed the laws, but they haven't implemented, they haven't started them up yet. And the next slide, I think, is the one that shows a coverage of adults. If Tina or whoever will, there we go. So our, as you can see, kind of like the uninsured, Texas has the worst coverage of adults in the United States. So we cover parents only at about 17% of poverty. This is a year-old graphic that they haven't updated yet, although they will soon. And I X'd out the 3 states that adopted Medicaid expansion since last January. So Nebraska, Missouri, and Oklahoma. And as you can see, we don't cover any so-called childless adults. This is a misnomer because it's really, do you have any dependent children at home? There are plenty of adults in the group of uninsured Texans who would like to or who could be covered under Medicaid expansion, who have children, but they're grown. So, being an older adult over 50, 55, you're not yet eligible for Medicare. Your health may be declining. Maybe you're widowed, maybe you're divorced. Your income has gone down, perhaps even as a result of that. That is another group. And we'll see some details on that in a second. But as you can see, Texas is at the bottom of the heap again. Next slide. This is just another graphic. If you've never thought about Medicaid before, or Medicaid, I like to try a lot of different ways to wrap your mind around it. So if you were next door in Arkansas, New Mexico, or Louisiana, or soon to be Oklahoma, basically setting aside the undocumented who are not eligible for Medicaid, if you were a child or an adult under 138% of poverty, you could get Medicaid. And then if you're above that line, you can get heavily subsidized coverage in the ACA marketplace. But here in Texas, because of that crazy low cap for parents that we have, and because we haven't done Medicaid expansion, we have this tiny little group of parents who qualify. Most parents will not, who are under the poverty line. And then there's no door whatsoever for adults without dependent children to walk through the door. Now, the weird thing is you do have a little subset of your Medicaid expansion population who are between 100% of poverty, the poverty line, and 138, which is the statutory, level for Medicaid expansion under the Affordable Care Act. So we do have some people in Texas who are in this income range who are getting subsidies in the marketplace. It's not ideal for them because it just wasn't designed to serve incomes that low, and there are out-of-pocket costs, but it is probably far better choice than being uninsured for some of them. What's next? Let's go back to that slide you skipped. I think there was one in between. Go up. I saw a couple of parents.
Hang on one second. I'm going to have to go into my controls here. Okay.
I think we just skipped one. Another option would be for you to unshare and for me to share mine, because I'm prepared to do that too.
Our meeting, you can't see it now?
Go back up to 11. You're on slide 12. Tina, would you like me to share mine or?
I am not good at this, and Michelle is the person who's running the slideshow, so you could just skip that one slide and move on, would be my suggestion.
Oh, there's the slide we were looking for.
There you go.
Okay, so just a reminder, most of our legislators do not understand this. You literally have a situation where a very low, a low income young family with kids, one that makes $800 a year more than their next door neighbors, the parents will get coverage for $46 a month or less. Sometimes they may even be able to find a zero premium plan, whereas their next door neighbors, because they're below the poverty line, because the Affordable Care Act says subsidies are only available above the poverty line, they don't have access to affordable coverage for the parents, and they would have to pay full cost of around $620 a month, which at $26,000 a year for a family of 4 before taxes, they probably wouldn't be able to do. Next slide. So we'll go through these fairly quickly. I just want to let's go slowly through 13, 14, and 15. The Kaiser Family Foundation has a special, you can go ahead and go to 13. The Kaiser Family Foundation has a special fact sheet for Texas. This is just close-ups of what's on the 2-page fact sheet. It shows you that the vast majority of these folks are in working families. It also shows you that the vast majority are people of color. And I think the last 14 and 15 are still coming, shows you where the concentrations of eligible people are. And then 15 reminds us that Medicaid expansion brings us a 90% federal share for the expansion population compared to the traditional Medicaid, which is what was in the pie chart I showed you, match rate of about 62 federal cents on the dollar from the feds. And then the Kaiser will give you a link to over 400 studies that show the positive associations with Medicaid expansion. So let's see what's on that next slide. So we have had, thanks to a lot of people getting fed up with the inaction of our state government, we've had a lot of folks stepping up to do Texas-based research on Medicaid expansion and the fiscal and other economic consequences of it. You will find a whole dashboard at the Episcopal Health Foundation's website. This is the link to the overall dashboard. I haven't, there are more resources here than I've even mentioned on this slide, but they commissioned a report from Texas A&M, from the Bush School, in which that researcher estimated that about 1.3 million Texas adults would be eligible for Medicaid expansion. That's a little more conservative than the Kaiser estimate. And then she went forward to go from who's eligible to her educated guess about how many would enroll. So she's got just under a million. She's assuming only 73% would show up. And based on that, Texas would get over $5 billion a year in new federal funds. They also posted a report from that was done by John Pitts's lobbying group or consulting group, I guess would be maybe lobbying and consulting group. Anyway, they did an analysis of the potential offsets to state budget costs and basically concluded that Texas would have to put up about $650 million a year to pay our 10% share of Medicaid expansion, but that our savings would be over 700 million. So that even if the state didn't do anything creative to finance its 10% share, it would still save money. And then we have a relatively new player on the scene called Texas 2036. And I will not do justice. I was joking with Tina about, how to refer to our office. And I used to get annoyed with a certain reporter from the Dallas Morning News if they called us left-leaning, but we certainly are more left-leaning than they are. I would say these guys are right-leaning, and they're not social justice driven. They're not mission driven. They are more talking about, how to have a vibrant Texas economy in 2036. But they have done, to their credit, they have done a great dashboard here showing, confirming that they find that Medicaid expansion would also be a very fiscally positive deal for Texas. And their numbers aren't wildly apart from these other analysts. There's also a couple of new studies from Dr. Ray Perryman. They're all kind of in the same ballpark. So I think it's important not to get caught up in arguing over the numbers at this point, but just to say, worst case, the best to worst case range of estimates that we have all show that it would be enormously fiscally beneficial for us to go ahead and do Medicaid expansion. So let's see what our next slide is. I'm not going to walk through this, but I put it here. You can go read this report and get into the details of it. But the Pitts report that we talked about did the savings to the state come from doing one of the things we already talked about, which is getting women to sign up for coverage before they're pregnant, so that, and if they do that, if they have comprehensive long-term coverage, then we'll get the 90% match for them, as opposed to the 62% match that we get today just during their pregnancy. There are other things like that save the state money. In addition, we reduce our state dollar spending on on healthcare for incarcerated prisoners, for community mental health, for substance use, for HIV, and for kidney health care. And in addition to that, we would rake in at least another 110 million in premium taxes, because almost 100% of Texas Medicaid is privatized through risk-based and regulated health maintenance organizations. Next slide. So I think that this slide, I just grabbed this from one of my coworkers who likes to put GIFs in her slides. I actually don't think this has anything in it. These are not different sources for the ones we talked about, but Perryman's reports are worth looking at, because he does do that kind of dynamic modeling about the benefits outside of just the state budget and to the economy and in terms of job creation. And then Texas 2036, as I said, was a slightly more conservative model. They don't necessarily agree that it's going to be free, but they agree that it won't cost more than $2 per person per year, which is close to free. Next slide, about more dollars. So the the American Rescue Plan Act, if it becomes law, is going to create a brand new option for the 12 states that haven't expanded and the 2 states that have passed the law but haven't opened up shop yet on their Medicaid expansion. And it's going to say that for 8 quarters, for 2 years, you would get another bump to your Medicaid matching rate. So you already got right now during the public health emergency this giant 6.2 point increase in your matching rate that translates, that alone probably will translate into at least $6 billion for Texas over about a 2-year period. In addition to that, they would add on another 5 percentage points for these newly expanding states for a 2-year period. And the estimates for that range from about 6 billion, which I think is on this slide, 5.97 from the Center on Budget in Washington. The Kaiser Foundation says about 5 billion, and Texas 2036 says about 3 billion. So I'm going to try to get better informed about the different methodologies that they use. But again, I think for those of us doing the advocacy role, the main thing is to say, even if it's the lowest, it's still a great deal for Texas. Next slide. So I think you guys are already familiar with this, but I just wanted to make sure you had these on the slides. Obviously, we have the Sick of It campaign, which I believe you're aware of, and definitely, I think whoever just put that question in, I think I just answered it. So add a new thing to the chat and we'll come back and cover it again if we need to. So next slide will tell us more about some of the action groups that are working on it. And none of these groups, if we'll go on, none of these groups are, like anything that requires, Blue Action Democrats to drop their identity and follow somebody else's play sheet. But if you get plugged into these two, entities, which you can easily do, by signing up for emails, then you will have an opportunity, to get updates regularly and to think about how you want to coordinate with other statewide activists. So you've got, I saw somebody posted that they hadn't heard of Sick of It, and I'm sorry about that. There was a statewide Medicaid expansion advocacy day on Friday at the legislature, a virtual advocacy day, pretty good one. We had 1,000 people participate. Not bad for an online virtual event. And so I think Sick of It is trying to not just be about Medicaid expansion, although that's the big bite, right? We're trying to say what we're sick of is having state leaders who have literally never acknowledged that Texas has the worst uninsured rate, or suggested that was a problem for our economy or for the people of Texas and their economic security, and nor have they suggested that the state has a role in it. So, it was an attempt to add one more piece out there to bring in people from around the state, not just nerds like me, raising their voices about needing solutions for the uninsured. So let's go on to the next slide. And there's, I believe on that one, we have the links to, that's the advocacy day that we just missed. So go on one more, sorry about that. And this is just some of the kinds of actions that Sick of It is doing with more grassroots people around the state. One more slide, and there are the links to both how you get on the Cover Texas Now list, but also if there are people from this group who want to get deeper into the weeds, this is the Cover Texas Now coalition started in about 2008, and we did it because our Children's Health Coverage Coalition, which has like the Medical Association and the hospitals and various other folks, they were so frozen by the dominant political narrative in Texas that they literally would not even talk about the national health reform debate that was happening. And so a lot of us got together and created a consumer-facing coalition to work on coverage issues. And there's a whole lot of overlap between us, and we share information and that sort of thing. But it is all about trying to do things about the uninsured rate in Texas. This list that we have a link to here, the subscribe list, that's kind of a big nice, pretty formatted. You won't hear from us more than a couple of times a month, except maybe during session when there's a call to action. And there's also an activist list that you can email me if you want to get on, but I will warn you that there's a lot of traffic on that during session because we're sharing intelligence with each other. And then, like I said, Sick of It, there's a link to join that as well. I don't know how you guys operate, but it could be a great thing even if only 2 or 3 or half a dozen of you guys are plugged into these listservs, then you'll get that intelligence when it comes up. I can't remember what else I have here, so let's see if there even is another slide. I think that was it.
Thank you so much, Anne. And Ross Pumphrey, who is our lead activist on Medicaid expansion, is going to be asking you questions from the chat and then some that he's prepared, I believe.
Great.
Hi, Anne. Thanks so much. I can't imagine having anybody any better to explain this relatively complex issue to us. Let's go back to that question someone asked in the chat, and I'm not sure if they heard you cover that point, but you could summarize it again about how the new COVID relief package would affect Medicaid expansion.
Great. So I'll backtrack a tiny bit just to remind us that one of the first COVID relief packages in March of 2020 gave Texas an extra 6.2 percentage points of federal match, which is probably over the length of the public health emergency going to result in us getting an additional at least $6 billion in federal money than we would have had. That makes a big deal because I frees up GR so that other things in the budget, so that Medicaid doesn't need to be cut and neither do other things. If you're not already aware of it, Medicaid is by far, by many orders, well, I'm gonna do my math wrong, but it is by far the largest source of federal funds in every state's budget. The next one you probably think of is highways. Education is smaller than that. Medicaid is like this big, and the other ones are like little bubbles over here. So that is one reason why when there is an economic crisis, Congress looks to the Medicaid match as the most potent, rapid, and arguably responsive to increasing need way to pump money into a state budget. So in 2008, the American Recovery Act, that is how they got money to Texas, billions and billions of dollars by jacking up that match rate. And it's responsive to people in need. So it's not a bad way to do that. So they have done that already. And now if the bill, I don't think there's any signs that if the House won't concur, I don't think anything has happened to hurt these provisions between the Senate and the House version. So hopefully next week, the Rescue Plan Act will go to the president and it will say, hey, you 12 states that haven't expanded yet, if you expand, we're going to give you for 2 years, in addition to the 6.2 that will continue until the federal public health emergency is over, which the feds have already said is going to last at least through the end of this calendar year, 2021. In addition to whatever you may still be getting from the public health emergency, we're going to give you another 5 percentage points of federal matching funds. And the estimates of how much benefit that would give to Texas range from 3 to 6 billion. So I can't tell you which one is right. I'm working on some research on that. But as I tried to say before, for our purposes and advocacy, I think we just need to be pointing out to our leadership that, regardless of which estimate is most accurate, it is clearly fiscally a huge good deal for Texas. In addition to the fact that while they refuse, while the leadership refuses to talk about it, it is also enormously beneficial to economic recovery of individuals and families in terms of, having comprehensive, very, very low cost healthcare, so that you're not having to spend dollars that you don't have enough of. It frees up your money, for things like shelter and food.
Thank you. Now there's a question in the chat that brings up a topic I have read just a little bit about, which is rural areas and how this could be particularly beneficial to rural healthcare delivery, rural hospitals. Could you discuss that for a minute?
Yeah, there's several. For one thing, Texas has led the country in rural hospital closures. And right now, one of the things that might have jumped out at you from that overloaded slide with all the uninsured data on it is that working age adults, a quarter of working age adults in Texas are uninsured. And so when you live in rural Texas and you're trying to keep, whether it's a medical practice or a clinic or a hospital open, and at least every fourth adult that walks through the door is uninsured, that makes it that much harder for you to have a viable practice. And rural hospitals do support Medicaid expansion. They are, you cannot, and they are getting more forthright about that, but it has been lots and lots of players in the healthcare scene are still very, very tentative about doing anything that will bring the wrath of the governor down on them. So, but this session has been a game changer in that result. Another rural consideration is, one of the things to think about is, think about how much lower the cost of living and the wage scales are in many parts of rural Texas. So that means you could be doing the same job in rural Texas and making half as much money as you might be doing the same thing in Austin. Yeah, I mean, school teachers, that sort of thing. You do have real disparities in cost of living and in pay scales. And so that means if you're one of those communities with the lower cost of living, that means you're going to have more people who are working families that are below poverty. It's going to be that much more common and easy for families to be below poverty. And so your families are going to benefit even more. And then I think I kind of downplayed the parallel issue for getting a doctor or a nurse practitioner or a clinic to operate in your rural community is that again, if suddenly a big chunk of the uninsured are gone and not gone, are covered, and you can actually get revenues for taking care of them instead of somehow trying to find a way to provide care for free, it can really make rural practices that much more viable. Sorry, I get distracted by the questions popping up in the chat.
One of the questions that popped up is about, I guess it's sort of your prognosis on whether or not this is going to get brought up.
Yeah.
It's going to get hearings this year, I think, right?
Yeah, I think, I mean, that is not to say that it's a slam dunk, but you have, I don't know why I haven't bothered to count the Medicaid expansion bills. You've got about a dozen Medicaid expansion bills, give or take a couple. And I think I might have sent you a list of them. But only one filed by a Republican at this point. And obviously, the big game changer will be when we get more Republicans speaking up. You have a situation right now where more and more and more Republicans are talking about it to each other. And they are not, it's like nobody wants to be the first one, except Lyle Larson, who filed his bill. And so kudos to him for trying to reach out to other Republicans, more moderate ones, rural ones, to try to build up more and more voices. And you might have noticed, we certainly did, because it's all we think about, that a number of Republicans that were in more tightly contested races did talk about Medicaid expansion during their campaigns. And then, the ones that won, maybe they're not as wild about it as they were then, but they're still talking about it. So I think that I think there will be a big revolt if there's not a hearing for Medicaid expansion bills, at least in the House. But then you have to remember, I don't think it's going to be a shock to anybody in this group that the Senate is just, way more difficult to deal with because of, the way that Lieutenant Governor Patrick operates. And but there's lots and lots of conversations going on there now. And so the combination of the pandemic, the fact that we have more uninsured Texans, just like we had gazillions of Texans who've never gotten food stamps before, we have a lot of people who've never been uninsured before who are experiencing it because of this pandemic. And also the wonky thing that's in the background, but if you know about it, it is important. And if you don't know about it, I apologize. It's painful, but there's this whole Medicaid funding pool known as the 1115 waiver, which has been giving big payments to make up for free care to the uninsured to hospitals for about a decade now. And that same pool also included another pool of equal size that was supposed to be innovative care projects. And about half of that pool was providing services to uninsured adults. And it is shutting down in October. That pool is shutting down. And because the governor, no one in the leadership of the state gave the agency a directive, to keep that program going, the agency really didn't make an attempt to keep that program going or to keep those programs going. What they did make an attempt to do was keep dollars going. And unfortunately for individual uninsured people in Texas, their solution was to try to come up with a whole bunch of new ways to pay hospitals and other healthcare providers, but mostly hospitals, which is great. None of us want the hospitals to close down, and certainly the uninsured need the hospitals to be there, but there's no solutions for the uninsured in there. It's a very institutional kind of response. So I'm sorry to inflict that on you. I know it's kind of wonky, but it is part of the discussion. And so it's one of the things that is bringing the attention of even some of the more conservative leaders, not the ultra conservatives, but to consider how they might look at a coverage expansion.
Okay, good. Now, one last question, which is maybe the perfect last question, because you've explained to us how attractive this deal is. So if there were a hearing, what would be the arguments against it?
China, freedom, sorry. So no, seriously though, some of them will say, we can't afford it, and part of it is, we all collectively have to change the narrative. I mean, Texas is one of the very lowest taxing states, in the country. And my brilliant colleague, Eva DeLuna, can tell you that, based on personal incomes in Texas, if we were still doing state taxes at the same level of the pot of money or the pie that is Texas personal income that we were in the early 90s, we would have something like 25 billion more dollars per session to spend. So about, 13 or 14 billion more dollars a year to spend. That's how much Bush, Perry, and Abbott have cut and cut and cut. And so it's like people don't notice that the pie is shrinking. The population is growing, inflation is growing, and the state revenue pie is shrinking. And taxes are never anybody's favorite topic. But how the hell did I get onto that, Ross? I want to mention one other thing, because I saw in the chat the question about race equity, and I think I would turn you back to that Kaiser fact sheet that shows that 75% of the uninsured Texans who could get covered under Medicaid expansion are Texans of color. And I think that you have to figure out the best way to talk about this. Talking to people who have never thought about this before, but it's sort of like Texas may not have consciously decided we don't care about Medicaid for low-income Texans because we're pretty sure they're all people of color and we don't care about people of color. No, Governor Abbott may not have had that thought consciously, but that's what institutional racism means. Systemic racism and institutional racism, are about the things that get baked in, and that's why we talk about unconscious biases. So, that's why it's important for us to be saying in the same breath, they're mostly people of color, and guess what? An even higher proportion of them are workers. So a lot of Texas policy is contingent on mythology that nobody is poor or uninsured in Texas unless they're not working. And it is a mythology. It makes you feel a hell of a lot better about ignoring the needs of low-income workers if you can just pretend they're not working and that, they're not deserving. So that was my little rant there.
Well, thank you very much, Ann. I'm going to talk about an action item for our group. But first, maybe I'll just, because there was so much information, maybe I'll just summarize sort of the bottom line, which is that Texas is terrible at providing health insurance. We have the lowest rate of lowest percentage of people covered. And expanding Medicaid would, if I remember all your figures, would add between, say, 1.3 and 1.5 million more people, make them eligible for healthcare who aren't eligible now. And that the principal groups that would be benefited would be rural areas, women, children, and people of color. And maybe that's sort of the bottom line for us, the way we think. So again, I thank you very much. Let's see here.
I'm typing into the chat a little bit about how to get some of the information that people have asked about, like who are the R's who've said something good and what are the against arguments. So I'm putting that into the chat for people who want to follow up.
Good, thank you very much. I'm going to spend just a few minutes here now telling everyone a simple action that you can take in the next day or two to help us try to move this issue forward. Nearly all the precincts in our chapter's territory in Southwest Austin have either Donna Campbell or Don Buckingham as their state senator. There are a couple of precincts in Sarah Eckhart's district, but for this discussion, I won't talk about Eckhart because she is supportive on this issue. Up until recently, it was pretty much a strict partisan divide on this issue, as Ann explained to us. But Representative Donna Howard told me in December that there were murmurings of some Republican support, and Ann reinforced that very strongly. And the example she gave, perhaps the most public example of this, is that Republican Representative Lyle Larson of San Antonio wrote an op-ed that appeared in both the Austin and the San Antonio papers about a month ago, stating that expanding the eligibility for Medicaid made good business sense for Texas. And he announced that he was introducing a bill to do this. So that's sort of the tip of the iceberg, we think, on what may be happening in terms of some movement among Republicans. So we're expecting that bills are going to start to get sent to committees for hearings very soon. I mean, hearing dates announced. So now is the time for us to communicate our support to our state senators in particular. And one reason that our state senators, Campbell and Buckingham, are really important is because they both sit on the Senate Health and Human Services Committee. So on the Senate side, and Ann explained the Senate side is tougher, the bill would go to that committee. It would have to get out of that committee first. And Campbell and Buckingham are both on that committee. So we'll put into the chat well, here's on the screen, you can see the action alert. And what we're asking people to do is to write a letter, and we've given you two options. The easier one, the one that takes less time, is to go to the online platform that Ann mentioned, the group Sick of It Texas. The last count I made on their website is that there's at least 30 statewide groups who are part of this coalition. So Ann and every Texan is part of that. And they're using this online platform, which offers pre-drafted letters. If you go to that platform, you'll fill in your name and address. There'll be a sample letter. I urge you to change that letter in some way. We don't want all the letters to read the same. If you have some personal story to tell, that's even better. And then once you've finished making some changes to the letter, you click submit. And because you've already put in your name and address, that letter will automatically be sent to your state senator and your state rep. Now, if you have a few extra minutes, there's another option that's a little bit more effective. And that is, we're going to give you, as you see there, option 2, is you go to the office website of your senator. And on that website, there'll be a link. There's a little envelope. You'll see a little graphic of an envelope. Click on where it says email, and then you can create your own letter. And we'll be posting talking points. Ann gave us a lot of things to say, so I think most of you know what arguments you can make. They're the talking points. So you can pick 1 or 2 or 3 that resonate particularly with you, put those in your letter, and then submit. That's if you're using the website of your senator. Those are slightly more effective because the senator's offices know when they're getting something through a platform, and they discount it slightly. But if you don't have much time, just use that Sick of It Texas site and send a letter to your senator. If you're in Senator Eckhart's district, you can just go to her website and just say, thank you, I understand you support Medicaid expansion. If you're writing individual letters and not using Sick of It Texas, you could also go to Representative Howard's or Representative Vicki Goodwin's site and say, I understand you support this issue, because they like to get support too. They don't like to just get opposition letters. They like to know someone out there is supportive of what they're doing. And then the last item of that action alert is phone numbers. You can do that either instead of, or preferably in addition to writing a letter. And your phone call can be very simple. You can just say, I would like my senator to support Medicaid expansion. You don't have to go on any big arguments. They keep a tally of all the phone calls that come in, and the numbers will be forwarded to the staff's boss. So anyway, that's it for the action item. Do you want to add anything to that, Ann?
No, I think the only thing I would add is they like to be able to honestly say, this is really important to my constituents, and I hear from them all the time about it. So when we forget to tell them because we think they're already on our side, that they need to hear from us.
Exactly. Well, thank you. So everyone go to that action item, that website, and action alert, and try to write a letter as soon as you can. And we'll see if we can get a hearing for the bill in the Senate and get some votes from our senators. And Michelle, I'll turn it back to you.
Michelle, you're muted.
Thanks. So I want to build upon what we've been talking about with the Texas legislature. We have created a Texas Ledge page on the website. So blueactiondems.com, TX Ledge. This really mirrors a lot of that block walking stuff we're doing right now. A lot of the language is similar. And then we're pushing these 3 issues from our group. Medicaid expansion is one. We've linked to Sick of It Texas here. I'll put the additional links that Ross has so lovely put together in the action alert here. Probably link to this document as well. So we'll update this page with that information. So if you're looking for it, you miss it at the meeting or whatever, we'll put it here. So this is where we'll have kind of ongoing actions that you can take during the Texas legislative session. And y'all, it's really not hard. You know, this whole idea of advocacy, lobbying, it sounds very intimidating. I will tell you, it's a simple matter of letting your reps know what you think. And we're going to be doing a series of kind of deep dives into issues so we can get a better idea, better informed, so we can advocate more effectively. So Texas Ledge, check out our page here and look here. Ta-da! You've got all your representative stuff right here. I would invite, if any of our other chapters are on the call, they can add their contacts as well here. But here's all your Southwest representatives collected. And you should know, based on your precinct, who represents you. If not, we've got a nice little handy link here. You can look it up. All right. That's it for the main part of the speaking today. I'm going to toss it over to Elizabeth Urbesnik now for a quick update on the winter storm.
Unfortunately, I will not be providing the update. We are joined today. As we all know, it actually is, I read somewhere somebody had said that our weather since the storm, it's just Texas gaslighting us, because we're like, did that actually happen? Were we freezing in our homes just a few weeks ago? We were. And many of us lost power. And I think most of us in Southwest Austin didn't have water for a number of days. And during this time, I don't know, we were also busy harvesting snow and filling buckets so we can flush toilets, or, you know, huddling around candles under terracotta pots. But a lot of parts of the city were struggling even worse. And I was really inspired by what our elected officials were doing. And so we're Joined today by Constable Stacy Suits, Commissioner Ann Howard, and City Council Member Paige Ellis. And I'd love to have them all just kind of describe what actions you took and mostly to what still needs to be done. I know people in apartments, especially where pipes burst and a lot of units had flooding and some damage. So what still needs to be done and what can we do? So
I'll jump in. I mean, I think, first of all, I think all of us worked hard and there's no sort of less suffering, if you're in a home without something, it's just rotten, just rotten. And so, just hats off to all of us that we're on the other side of that. And, even when we were maybe short with people or, really frustrated, we made it through that. And that was a really unique Austin, Travis County experience for most of us. And so, to me, whenever we go through something, it just sort of unveils where so much work is needed and where there are strengths to build on. And so, I think the first thing that we realized, or that I realized, is, oh my gosh, I'm supposed to know stuff and I don't know much, when people reach out to you for help, especially in a world of social media, they want instant answers and solutions. And the way the county communication is set up, a lot of elected officials didn't have information. And so, we scrambled to do what we could and to keep banging on the doors of the staff who had the information. And we will definitely revisit that because I think there's a way. At one point, Vicki Goodwin and I were talking, if we could all sort of divide and conquer neighborhoods, so that they would know, you just have to ask Vicki, or you just have to ask Stacy or Paige or Ann. You don't have to ask all of them. You have a point person, like a phone tree in a way, of who your person is that's going to make sure your needs have been heard. I think there's a lot of things we can do in the future that we were all sort of uncovering. Oh, this is how it works. Well, that might not be the best way in 2021, So, but, there was an initial, my concern was shelter of people experiencing homelessness. That's just where my mind goes to, because they've got it a lot worse than I do. And then immediately, when people who had homes were losing power, and then the water crisis, we just had to sort of keep pivoting to what's the next big need. And just one beautiful example of people helping each other was, the city of Rollingwood had some water. AISD trustee Arati Singh knew where water was needed. My staff was connecting Rollingwood and Arati and those families. And then we needed a little bit more security, confidence, and Stacy Suits stepped in. So it was all these different levels of people reaching out to play their role. And I just, hats off to everybody. I'm sorry it was such a mess, and I'll just keep working hard to serve you so the next time we're more ready. But thank you very much.
And it's a really great point about how people look to elected officials for answers, and sometimes we aren't being provided the information that we are trying to share with people. So this was something I've had conversations with, especially the water utility, because I'm the past chair of the Austin Water Oversight Committee. And so I had a good working relationship with a lot of the officials over there, and was just really surprised at the lack of information that was being shared. And so that's when I realized, a lot of people, the earlier parts of Southwest Austin that ran out of water in their pipes as early as Tuesday night, it was Thursday before we were able to track down water. So I got on the phone with Constable Stacy Suits real quickly and said, do you know where we can find water? This is a thing that I thought the city would just have water somewhere, and they didn't. They had ordered it, but they couldn't tell me when it was going to get here. And so our first location was one of Stacy's connections that he had. And then after we went through that, I got on the phone and called a friend of mine, Matt Lucky, that owns the Meat-Eyed Cat and Star Bar and the Lavaca Street bars, thinking maybe he would know a brewery where we could do mass fill-ups or something. And he said, I've got some pallets full of bottled water at my warehouse. And I was like, oh my goodness. So me and Stacy, hop in the car and go over there. But really, we had to team up and try to find whatever donations of bottled water, or the county was able to pay for some, to be able to connect it with people. Because as many of you know, the city water distribution didn't start until Sunday. And for people to be without plumbing from Tuesday to Sunday was just something that I never imagined in my wildest dreams that holding elected office would demand of me. But when you have great people working alongside you, like Commissioner Howard and like Stacy Suits, Donna Howard found some pallets of water for us from Walmart. They were able to donate. So we were really all on the phone together, trying to coordinate how this was going to work. And at times I ended up with a truck full of water and I didn't know where I was going to take it next. And we just started trying to hit neighborhoods as best we could, filling in the other elected officials along the way to say, if you want to meet me there or help. But it was really amazing to see people show up needing water themselves and to stay to distribute water to their own neighbors. And that to me is really what showed the passion of the elected officials, the passion of the constituents we serve. And it makes it really nice to be able to represent people and to see the genuine good-hearted nature of Southwest Austinites. And it was a terrible situation, but had some real heart and soul to help each other get through it.
Yeah. Well, basically what we were doing was damage control as fast as we could do it. I had 103 cases of water stored in the stairwell at my office that Eeyore's birthday had left over one year to hand out to the homeless during heat waves. And, Paige asked me about where we could find water. I said, well, I've got water here and I've got 5-gallon jugs of office water. And I talked to our JP, Sylvia Holmes, and we got that. And we got that water out on Wednesday. On Thursday, Martha Maddox, Jim Maddox's former AG's widow, owned Texas Crystal Water Company, and she had sold that company, had extra inventory. She donated 7 pallets, and Councilmember Ellis and Rich DePalma and Circle C got that stuff out in Circle C in the first area that went out. Then on Friday, the city was having problems getting the water purchased from Matt that was left over from the canceled Austin city limits. So I bought that on an emergency PO out of my budget on the county dime. Doesn't matter, we're gonna get reimbursed by FEMA anyway. And we got that out, and that's when we started to identifying about major problems so that we had with the apartment complexes. And the focus on Saturday was trying to get water to these apartment complexes. And I might add, it's like we had heard that the FEMA water was actually in Fort Worth on the tarmac Wednesday night, but it wasn't. They didn't start shipping it till Austin until Friday, and we didn't start distributing it till Sunday. So there's a delayed reaction on the federal and state level on getting stuff out. So what I learned from this and in forward planning is, for fires, floods, and any more events like this, that not only am I going to stockpile water in my office, I'm going to stockpile even more. So we've got it ready to roll while we wait for federal and state to figure out what they're going to do, that we have stuff on hand that we can move out.
Yeah, and I think there needs to be more communication. I've brought this up to city officials and said, just because something isn't necessarily the sole responsibility of a water utility, it doesn't mean you can't share vetted links to say, this is how you prepare for 3 days without water. This is how you prepare for 3 days without power. And so I think that was some of the information that they kind of thought, you know, we only control the actual water flowing through the infrastructure. But when people look to you for answers and you are a public utility, you have to at least connect them with the next thing to research. You know, where else can people go? How do you layer up? Like very, very simple things that you wouldn't necessarily think. Austin Energy needs to teach people how to layer up, but if your home temperature is very quickly turning into freezing temperatures, you need to know how to wear wicking layers. You need to understand how to conserve your own body temperature. And so those are some of the things that I want them to be better about moving forward. Because we used to think these things will happen only once in a lifetime, and now they're happening every year, or they're happening where you end up in a pandemic without heat and without water. And no one really thought all of these would be layered on top of each other at the same time, but it just is increasingly the world that we live in. We don't know, you know, going back to normal, what is that? And a lot of us have been emotionally and psychologically scarred by what this last year has held for people. Like we won't be the same again. Now I understand why my grandfather, who grew up in the Great Depression, behaved in certain ways where he just never let go of some of the habits that he had, because that was survival back then. And you always want to be prepared for that. So we certainly have done a lot in trying to get more communication and a better understanding of how we expect our public services to operate. And then looking forward at, you know, what are we going to do to help people with high bills, with leaks and things like that. So this past week, we started looking at providing more in the customer assistance programs and changing the tiered rates of how water bills will come out, and a better understanding of how to look at averages and things like that, because you really can't just look at water use over the past month and get a really good understanding of what needs to be charged to people. So they've been good about that, much better than they were at communicating. But it's definitely on our radar to make sure that people don't get hit with high bills on top of everything else.
I think what you had mentioned about the communication, I know somebody put something in the chat about the pipes. And I know for a while we were all crowdsourcing on what do I do so that my water heater doesn't explode if we lost power and water. And I think exactly what you were saying, just if this information had been provided to us, it could have been a little less stressful. And so I messaged Paige on Facebook in the evening, and she found that information about what to do about the water heater. So thank you for that. Just because, again, we were just looking it up and we didn't have a good source of where to find that. I know another thing that has come up is for a lot of us, this is over, right? Our water's running, our electricity is restored, but I live near some apartments and 55 units were destroyed because of exploded pipes. So what do you guys have any sense of what the recovery period is for all of the people who were displaced by damaged apartment buildings? Or I mean, I know for a lot of units around Southwest Austin that was a reality.
Right, there is a lot of work going into, you know, how do we expedite permits? How do we make it affordable for apartment complexes owners and managers to be able to do that work? So we are still looking at it, but they are definitely trying to make sure people can get back on their feet as quickly as possible. The apartment situation was something that came onto my radar because we were trying to make sure, you know, that each neighborhood was getting some level of water distribution, whether it was bulk containers or cases of water. And we went over to the Spyglass area, the Barton Skyway, where they have the original Taco Deli. And we just went to go check because we knew there were like 5 big complexes over there. And that's when people said, we still aren't online. The buildings have water access, but until they fix all of the units and all of the fire safety infrastructure, nobody gets water. So they were doing it piecemeal, building by building. And then we found out that not only were a lot of the plumbers completely booked up, but they were starting to run out of supplies. So one of my colleagues, actually Allison Alter, was working with Plumbers Without Borders, I think is what it's called. And, you know, so we were all kind of working on something different and trying to help each other and try to do things for the city. And people really noticed that Southwest Austin was hit the hardest. It was the first to go offline and the last to come back on. And so now there are plumbers coming in from out of state. The state did allow for people who were retired plumbers to be able to come back and help, you know, come back into work to do that. And then some of the people who were closer to getting their plumbing licenses were able to kind of get that emergency approval to start doing plumbing. So there's a lot of different angles to be worked on. I mean, it's really interesting. You solve for one problem, then you realize there's another problem here, and we need to, you just keep working. You just keep going. The next issue that comes up, you just jump on that too and work on it.
Yeah. One thing I'd like to point out is, when I was in UT in the early 70s, I believe it was 73, we had a major power outage like this, you know, for days. And at that point in time, it was caused by, we had coastal states and Oscar White. We couldn't get enough gas, natural gas. Austin's energy grid was more or less all natural gas driven. And then in the around 77, we had an election and joined, bought in half share of Fayette Coal Plant and in the South Texas Nuclear Power Project. So we wouldn't get held over the barrel again with failure of the natural gas system. We have enough natural gas to run our plants. So I was really perplexed that we had such a grid loss because, we had attempted to deal with that the best we could, policy and planning wise, in the 70s. And so I just don't know what to say. I was just shocked by, the dominoes falling, first the electricity, then the water, and then just the bureaucracy of getting things done and getting it back up, and the communication problems. We literally were tied in our response of, we had deputies, and I myself, I was literally in for 3 days. I couldn't get out. Very spotty internet, if at all, mainly communicated by text. A lot with Paige, Donna Howard, and Vicki Goodwin on doing what we could do with what resources we had. And all I can say is, and it gave me kind of pause to think, is like, well, especially with this election coming up in May concerning the camping ban, is, well, now a good part of Austin knows what it likes to be homeless, about being cold, wondering where you're going to get your next meal, and trying to find water. So we got to do better in the future. We will do better.
Mm-hmm. Well, I know we really greatly appreciated all of the work that you did. And we had that slideshow of just being out in the community, passing out water, and getting us the information we need. I think I speak for all of us where we really appreciate all of the work that you guys put into helping out down here.
Happy to serve. It's a good constituency.
All right, thank you so much, Elizabeth, and thank you, Stacy and Paige. It's really great to have you guys join us. Really feel very grateful for the discussion. I thought it was quite enlightening and helps us move forward, because I'm sure we'll see it again, unfortunately. Climate change is with us. So finally today, I just need to tell you goodbye, I guess. Next meeting is going to be about the May election. Lots of, as Stacy indicated, lots of things on the ballot we need to talk about and learn about. And we need to remind our neighbors to vote as well. It's going to be an important election to turn out and make sure that our values are represented. So I'll be sending out a link, but it's the same Zoom meeting link, y'all. So you can just make a note to keep hang on to that link for today. We did share a ton of information today, everything from how to volunteer to help vaccinate your eligible neighbors, to bylaws. Remember, we're going to vote on those. To action items. You can either get involved in dropping lit to your neighbors, or you can write some letters about Medicaid expansion, which is high time that we get that done. It is hurting us. I would really encourage you guys to listen to that Ezra Klein podcast that I posted on the chat. It is crazy. It is crazy how racism is just hurting everybody. So let's redouble our efforts on that as well. And thank you. Thanks for turning up month after month. We really appreciate it. We'll see you next month.